With its proximity to Lagos State, which is the epicenter of the coronavirus, neighboring Ogun State has managed to keep its case numbers low. At the last count, Lagos has 306 confirmed coronavirus infections, while Ogun has 12. TVC News' Bukola Samuel-Wemimo had a chat with Dr. Tomi Coker, the woman in the front line of the pandemic in the Gateway State.
Dr. Tomi Coker resumed duty as Ogun State Commissioner for Health on the 20th of December 2019. 6 weeks later, she was thrust into managing a pandemic. While states far-flung from Lagos have experienced a steady increase in the spread of the coronavirus, the curve in Ogun State has remained low despite its proximity to Lagos. How has the state kept community transmissions at bay?
Well, in Ogun State, on the 27th of February, we had our index case, which was a gentleman visiting from Italy. And he was on a private property, a company, which was able to accommodate all his contacts, the 40 contacts in a single occupancy room, which meant the self-isolation was very effective. I think that initial intervention actually helped Ogun State in containing the disease at its early stages and reducing the risk of community transmission.
Ogun State has a flexible lockdown policy where residents are allowed to go out every 48 hours. Could it therefore record more confirmed cases if it tested more of its citizens?
Perhaps we're not testing enough, we don't know. So what our strategy now is with the lockdown is to actually go out and test more of the population. We've deployed an app, a mobile app, which people can access to self-assess their risk of developing COVID-19 disease, which would classify to mild, moderate, and high risk. And the high risk group would be flagged off on a dashboard which resides in the Ministry of Health as red. And the state epidemiologist then follows up.
The commissioner explains that the cost of testing and capacity of the health management system is one of the challenges government is dealing with amid efforts to combat the spread of COVID-19.
The reason for not doing a generalized testing is perhaps the cost as well, because the cost of each test is over 10,000 naira for each test. There are some tests being peddled around, which are the rapid tests, which they tell you can get the results within 15 minutes. Those tests have been proven to be not as accurate. The sensitivity is as low as 30 to 60%, and with a high false positive rate, which means people who are positive, you'll only pick 3 out of 10, which gives you a false reassurance and not appropriate. The appropriate test would be to do the PCR test, which involves having a molecular lab.
However, the commissioner also gave assurance that healthcare providers on the front line in Ogun State have been provided with personal protective equipment, even as government has mandated the tailoring departments of all hospitals to begin manufacturing an initial rollout of 5 million face masks. Bukola Samuel-Wemimo, TVC News, Lagos.